great opportunity to move along this spectrum to really focus on managing stormwater close to the source and in the most natural way for that environment as possible. Listed on this slide, which is titled "Slow It Down, Spread It Out, Soak It In," and that really is the model of stormwater management. You can slow it down, spread it out over the most amount of area, and let it soak in. That's the most effective way to go. Lots of different techniques for managing stormwater. There is no one best answer or best solution. It's really a case-by-case issue for the facility, for design and implementation, for operation and maintenance, for runoff, for the amount of water that's treated. It depends on the type of institution, as I said, resources and time. Spoiler alert, at Star Harbor Hospital, we focus on bioretention cells. We looked at green roofs and also pervious pavement, but that didn't really seem to work for the case at hand. And for the pervious pavement, the reason it didn't work is because, as Ashley educated me on this, he schooled me, that the soil in Baltimore City is too clayey, very clayey. Has a lot of clay. So it's not appropriate for pervious pavement. This, however, is an example of Peninsula Regional Medical Center on the Eastern Shore. They put in a 2-acre pervious pavement lot, and this was, I think, probably 5 years ago. And so the rain passes through the pavement directly to the soil to replenish the groundwater. It eliminates the runoff, and it filters out the waterborne pollutants. One of the additional benefits that Peninsula Regional Medical Center experienced that was an unintended benefit, because the concrete is much lighter than traditional asphalt, it reflected the light, and they were able to reduce lighting in the parking lot by up to 30%. Excuse me. So Shady Grove Medical Center in Montgomery County implemented a green roof. This is a 20,000 square foot roof over the operating theater, and in 7 months' time, and with a very large gift of $250,000, it went from this to that. And they transformed this barren rooftop to a healing garden. And going back to what Ashley said about environmental health and public health, healthcare institutions are seeing this issue of stormwater management as a way to connect both environmental concerns, financial concerns, and environmental health concerns.
So who gave them the money? Is it a grant they could apply for, or where they used the
That was a private gift.
Private.
The name of the garden, I forget the name of the garden, but the person who donated the money has their name on the garden. So, but hospitals are now understanding that healing gardens are good for patient health as well as staff morale and retention.
You mentioned this over the operations, operations, right? Do they borrow all this routine?
Well, I think in the design and construction, they would account for that, and if you're interested in the details, I can certainly forward you the case study related to that. And finally, here is Kent Hospital in Rhode Island. They used bioswales, rain gardens, and water-efficient landscaping, and they shifted to a scenario that both reduced maintenance and costs. So they capture and treat stormwater as close to the source as possible. As we talked about earlier, filtering out and treating the runoff. They use predominantly native grasses, shrubs, and perennials. They don't use pesticides, and they don't spend money on irrigation. So again, thinking about that evolution of stormwater management practices, they shifted from this model of conveying water away from the property as quickly as possible to treating it as close to the source as possible. And in doing so, they also eliminated some parking spaces, so they decreased the impervious surface as well. So win-win for the hospital, financially, economically, environmentally, and for public health. So with that, the star of our show, Brian Gray, to talk about
You gotta fall off the stage.